Hi guys, Adip here for Movement Science. Today in this podcast or a video podcast you can say, I've got Lara with me and she has done her masters in Belgium. So I would not waste much time. Can you introduce yourself, Lara?
Okay, so like Adip has already said, my name is Lara the Miranda and I've done my masters in Belgium, but I did my bachelor's in Manipal, which is the same university as Adip.
Yeah.
And between my bachelor's and my master's, I also worked for 2 years, almost 3 years actually. Yeah.
So what was that work experience like? What did you do?
So initially, I started working at Physiotherapeutics itself, at the clinic that I'm currently at as well. And my first, within a month, I started working at Salgaunkers with the junior teams, so under 18 and the first division. And then I also used to go with the under 14 and the under 15 as well. So that was for most amount of my time I spent working with the Salgaonkar team. And then in between, I also worked for a brief period of time with the India under 15 football boys team.
Yeah. That's great. I didn't know that about that. So after that you did your masters in Belgium.
Yes.
So my major question to you is, what made you do your masters at Belgium? And there are so many other options, right? UK, Australia, that people mostly prefer.
Yes.
And also US. So what made you think abroad first, and then why Belgium? That's very uncommon.
Firstly, I decided to go abroad. Mainly it was because to just like for the whole experience, basically. First of all, to be in a new country, to be in a new continent. And then secondly, it was also because maybe to get a different perspective on how to go about the treatment and rehab program planning for the different injuries that we have here. Because what I realized was that when I was treating my patients over here, I realized I needed to be a little more specific and maybe make my treatment sessions a little more evidence-based.
Yeah.
But I felt like I didn't have enough knowledge or the necessary guidance to go about it, like to actually do it. I know what I wanted to do and how I wanted to do it, but I didn't know how. I knew what I wanted to do, but didn't know how. So, and it's not that this does not mean that in India the universities don't provide you with this knowledge, but I just feel that when it comes to the countries like out of India, I think it has been something that is more prevalent in those countries, like where they practice more evidence-based practices. Evidence-based practice is basically more prevalent in those countries compared to India. It is upcoming, of course, but at that time I felt like that would be an environment where I would be able to do better and get to my goal faster. So that was one reason why I decided to go abroad mainly. And then I did consider, actually, like you said, Australia. US I didn't really consider, no specific reason, but UK initially I was considering it, but then I had, these are of course my personal opinions now. In UK, most of their programs, what I had looked up were 1-year programs.
Yeah.
So I didn't want to cram any information and study everything within 1 year. So Australia was on my list, and but then Australia as well, in the year that I wanted to apply, they made their 2-year program into a 1-year program. And then I also considered the fact that when you're in your masters, you have your thesis to do, you have your internships to do, plus the curriculum that they had for the 2-year program remained the same for the 1-year program.
Okay.
So if I actually wanted to learn and absorb all the information that they were teaching me when I went all the way there, at least personally, I felt like it wouldn't be possible for me to do it within a 1-year span.
So again, it's just like too crammed up.
Too crammed. I felt like it would be too crammed up personally for me at least. But that's of course a personal choice. But and then when I decided on Belgium, I actually found a senior of ours who had also studied in Belgium. And then I also compared the curriculums, which were more or less say 75 to 80% very similar.
Curriculum as in like what exactly did they cover?
The subjects that they were covering, because usually in the first year everywhere.
What was your master's about?
It was called Masters in Rehabilitation Sciences and Physiotherapy. And I did the specialization sports.
So was that like a second year?
So in this university, how it would usually work is, as internationals, you needed to go there 6 months before your master's actually starts. And then you would have 5 exams at the end of the 6 months, which were basically the main subjects of your bachelor degree. And only if you cleared that, then you get into your master's program. And then your first year masters is usually general. So it's not, you have maybe 1 or 2 subjects in the second semester of the first year which is specific to your specialization. Otherwise, it's more general in relation to research, then in relation to medical imaging and like subjects like that, physical activity, physical fitness, and biomechanics, which is one of the sport-specific subjects that we had in the first year. And then it becomes more specific when you go to the second year.
Okay.
So that's how they went about the program.
So you guys would cover sport-specific topics too. Like, what was the curriculum like? Were they more focusing on academics or more of practicals? Because I've heard abroad, it's mostly academics, it's mostly research-driven, and the practicals aren't focused that much compared to India, where they give you a lot of hands-on practice. That's what I've seen as being one of the most advantages of studying in India, that you get to treat patients more, hands-on experiences more compared to academics. So what was your experience regarding
so
that?
I know where you're coming from, because what you're saying usually happens at the bachelor level.
Okay.
So over there, they're not allowed to touch patients absolutely nothing during their bachelor degree.
Okay.
So they have observerships, but they themselves do not treat patients, and they're not given full like, how do you say, they're not completely allowed to treat patients themselves. They always have guidance and always have people looking over what they're doing. They're not allowed to make decisions for themselves during their bachelors.
Yeah.
But in the masters, it's exactly like here. So you get, I had internships as well. I had various internships when I was there, and you're given complete control over what you want to do with your patients.
Okay.
So maybe the first week, you just follow around to see how their system works, because ultimately we are all coming from countries outside of Belgium. So in the first few, maybe a week to 10 days, like if it's your first internship especially, they ask you to just observe, but still they will always take your input on what you want to do with the patient and what would you do differently, and they're very open to whatever opinions you have.
Got it.
So they will never disregard any opinion or suggestion that you give. But then after a week to 10 days, if that's only during your first internship, but if it's your second or third internship, from the first day itself you have full hands-on, like complete control over what you want to do with your patients.
Okay.
But
So that was the clinical aspect.
yeah, that was the
And
clinical aspect. So now, like how you said, like, is it more academic or is it more practical? I think there was a very good balance between both, especially when it came to, we had a lot of, in this university, it's a research-based university, but we also had a lot of manual therapy.
Okay.
So when I went there, like I told you, in the first 6 months, we have like all the subjects that are taught to their bachelor students during their bachelor degree. But they also have a lot of practical aspects in terms of like exercise therapy and manual therapy that's taught to their bachelor students. Now in terms of exercise therapy, I felt like I was well equipped to actually deal with the level that they expected us to be at the start of the masters. But when it came to manual therapy, I felt like I was absolutely, maybe I knew 30 or 40% of what they expected us to know. And this is something they teach to their students, that is taught to their students in the bachelors.
Yeah.
So that was something I had to really work on in those first 6 months. And then in the first year and the second year, they build on that manual therapy as well as exercise therapy knowledge that you already have. So you have practical sessions, which are at least 3 times a week.
Okay.
And it's like it's like either the whole morning or the whole afternoon.
Okay.
And then
just
you
like
have,
how they have it over here.
exactly.
In bachelors.
And then you have your theoretical sessions as well. So I felt like there was a good balance between theory and practical. And of course, I'm concentrating and saying that there was a lot of manual therapy, and I know that maybe like evidently, like based on evidence, we don't use manual therapy, should not be like in most cases like the major part of our treatment, but it is in certain patients it's necessary, and
Just to
I think it's
facilitate.
nice to know it. I think it's nice to know it. Yeah.
That was nice. So last question I have for you, and we'll wrap up the session, is if there's a guy or a girl who has finished their bachelor's and looking to do their master's, and they are confused with where to do it, here in India or abroad, which countries. So what would you say, how do they go about this?
I think it also depends on what you're looking for in your master's program, because now I wanted to do my master's in physiotherapy in sports. But there are a lot of physiotherapists, once they graduate from their bachelor's, maybe they don't really want to do their master's in physiotherapy, maybe they want to branch out into something a little more specific. Maybe just strength and conditioning, or maybe just, I have like certain juniors and colleagues who have done their masters in or MSc in UK and other countries as well, like maybe just in football, or like very things that are very specific like this, for example, and not just maybe general physiotherapy as such. But so I think it also depends on what exactly you're looking for and what you want to do your master's in. And I think it's also now, for example, I already stated what were the aspects I considered when I went to do my this. So those were all personal choices and personal decisions that I made based on what I wanted abroad,
so
like what I wanted.
Yeah, so if you would list them down, one was exploring.
Yeah,
just exploring.
that was one, yes.
And then finance is another one.
Yeah, so that's another thing. You really need to consider your finances also. I think one thing, if for me, I knew I always wanted to come back to India. But I think if you are somebody who knows you want to stay abroad, and if you're very sure on which country you want to settle in, I think that makes your decision a little more easier that I want to go abroad and I want to, because it's not that you can't get a job abroad if you've done your masters here, but I think it's much easier for you to integrate yourself into their system if you've done your masters there. It's easier for you to search for a job and integrate yourself into the way they work if you've already done your masters there. So I think that would be one aspect which would make your decision easier, but otherwise I think most of the things that you consider would be more personally what you would consider important to you.
And for that, I feel some degree of experience, working experience after bachelor's is required, right?
So I think,
or else you just know what you're doing.
Yes, that's very true, because I noticed it even when I went to do my masters now. Like a lot of us among the international students, we were quite a big percentage of us that had already worked for 2.5 years almost. And that helped us a lot during our internships, and even the way we went about, even during our day-to-day classes when we had theoretical classes. And because even though we have theoretical classes, the exams that we have there, or even questioning in class and discussions we have in class, are very application-based. So I felt like the people who had already worked had something to they had something to compare it to, or maybe a patient they had seen in the past to compare it to.
That's so true.
And it helped a lot, because we had a major portion of our second year where the portion becomes more specific to what we want to specialize in. We had a lot of case discussions, a lot of them. So a major portion of our syllabus was case discussions. So it helped a lot with that as well, where if you've already worked before. Otherwise you're completely lost, because theoretically you know that you're supposed to do this, but how to exactly apply it when a patient is in front of you, I think that comes with work
I feel like you don't even need a master's for that. Like, for example, if we do our bachelor's again now, the way we will learn everything will be just completely different.
Exactly. The way you see things will be very different. The way you analyze all the material given to you will be very different.
Exactly. It was really nice talking to you.
It was nice that you had me here. Thanks for having me on your channel.
We'll do more of these in the future.
Yes.
I hope you guys liked the video. Don't forget to like, share, subscribe to my channel, and see you guys in the next video.